Q1. In which of the following situations is the informed consent valid? A. The client signed the informed consent after receiving a dose of sedative. B. The nurse asked the client to sign the consent form after she explained what will happen to the client during the surgery. C. The nurse witnessed the patient's signature after ensuring that the client understood the information provided by the surgeon and the anesthetist. D. The consent was signed before providing the client with appropriate information. Q2. Who among the following is not legally allowed to witness the signing of a consent form to a surgical procedure? A. The parents of a patient. B. The patient's surgeon. C. The nurse in charge of the patient. D. The head nurse. Q3. Who among the following patients is not legally allowed to give their consent to a surgery? A. A 16-year-old married male. B. A 15-year-old female who is independently earning her own living. C. The parents of a 7-year-old female. D. A 25-year-old male given Demerol for preoperative pain. Q4. In the course of the preoperative assessment, the perioperative nurse should make sure that A. Obtain informed consent from the patient. B. Ensure that a signed informed consent is in the patient's chart. C. Explain the risks and alternatives of the planned procedure. D. All of the above. Q5. The primary role of the nurse in the acquisition of informed consent is A. Obtain informed consent from the patient. B. Ensure that a signed informed consent is in the patient's chart. C. Explain the risks and alternatives of the planned procedure. D. To witness the signing of the consent only. Q6. What is risk management for perioperative nurses? A. It is the responsibility of the facility's risk manager. B. It is an ongoing effort of identifying and preventing potential harm to the patient by all members of the hospital staff. C. It is only the responsibility of the surgeon. D. None of the above. Q7. Policies and procedures on risk management of the institution or facility A need not be consistent with those of regulatory agencies. B. Not relevant to the management of risk in the perioperative setting. C. Should be consistent with regulations of government and other outside agencies and professional standards of practice. D. All of the above. Please like and subscribe. Q8. The Joint Commission on Accreditation of Healthcare Organizations, (JCAHO), model of risk management and quality assurance for healthcare facilities includes A. Continuing education and the use of patient survey data. B. Credentialing rules for healthcare practices. C. Establishing written criteria to evaluate risk. D. All of the above. Q9. Risk management areas of concern in the perioperative setting include A. Effective communications, verifying patient ID, surgical site and procedure, and protecting patient property. B. Proper positioning of patients, maintaining aseptic technique, and making accurate counts. C. Operating equipment safely, preparing specimens, taking appropriate nursing actions, and documenting care accurately. D. All of the above. Q10. The doctrines of the captain of the ship and borrowed servant are favored by most court systems today in evaluating the legal responsibilities of nurses in the perioperative setting as they may apply to negligence and malpractice. A. True. B. False. C. Sometimes. D. Maybe. Situation 7. The perioperative environment is a unique environment. Q11. In the perioperative environment, the message must come across to patients arriving for surgery that A. The patient should dispense with any preconceptions about surgery. B. The surgical team has all the patient's information it will need. C. All equipment, staff, and supplies are ready and waiting in the OR. D. The patient is at the center of all we do. Q12. Upon arrival at a medical facility for surgery, considerable anxiety may be experienced by patients who A. Do not have enough information about their surgical procedure. B. Have had prior surgeries. C. Do not have serious illnesses. D. Meet any or all of criteria the above. Q13. The circulating nurse's role is to A. Conduct the instrument, sponge, and sharp counts with the scrub nurse. B. Remain at the patient's side to reassure the patient. C. Gather positioning equipment. D. Begin entering data on the perioperative record. Q14. In the semi-restricted area of the OR, A. Traffic is limited to authorized personnel and patients. B. There are areas where instruments may be stored or processed. C. Is where peripheral support areas are maintained. D. All the above conditions apply. Q15. In the OR, the role of the scrub person may be filled by A. The circulating nurse. B. The registered nurse first assistant. C. A CAN. D. An ST or CST. Q16. Perioperative nursing had its beginnings in A. World War I. B. The Crimean War. C. The Korean War. D. The Spanish-American War. Please like and subscribe. Q17. Maintaining the sterile field does not include A. Scrubbing hands and forearms for at least 2 to 5 minutes. B. Donning a surgical gown selected from the sterile instrument table. C. Double gloving and wearing masks. D. Holding the hands above the elbows after the scrub. Q18. In the OR, on the draped back table, only A. The table front and surface are sterile. B. The area from 2 inches below the table surface and up is sterile. C. The circulating nurse counts and positions instruments on the surface. D. The surface is considered sterile. Q19. Sterile drapes should A. Not be subjected to rapid movement. B. Be placed on the patient before entry into the OR. C. Be draped over the OR door to create a sterile barrier. D. Never be placed on OR equipment. Q20. Appropriate positioning of the patient for the procedure ensures A. The patient will be able to communicate with the team. B. The patient will not be able to pull off the surgical drape. C. Optimal exposure to the surgical site. D. Opportunity for observation of the procedure. Q21. Calling a timeout before beginning the procedure allows for opportunity to confirm A. The nature of the procedure. B. The name of the patient. C. The correct patient position. D. All of the above. Q22. Teamwork in the OR includes A. Understanding who is in charge. B. Maintaining an awareness of individual capabilities and responsibilities. C. Keeping track of who has made mistakes. D. Offering to take over another's duties. Q23. Fast-tracking a patient is possible because A. Health insurance companies support quick discharge of patients. B. Patients are motivated to be out of the hospital. C. Available medicines and post-operative care directions make home care more effective than it has been in the past. D. New advances in anesthetics allow patients to be awake and stabilized in less time. Q24. In the first few minutes of PACU care, assessment should be made of the patient's post-operative A. Vital signs, cardiac status, and level of consciousness. B. Pain management, skin integrity, and experience of nausea. C. Allergies, sensitivities, and lucidity. D. All of the above at the least. Please like and subscribe. Q25. The person who develops the patient's plan of care is the A. Surgeon, using the physician's pick list. B. Circulating nurse, consulting HIPAA. C. Pre-admission nurse, using the PNDS. D. Preoperative nurse, using the PNDS. Situation 8. Many complications can arise post-operatively due to the effects of anesthesia and immobility. To prevent these complications, patients need to be instructed to perform post-operative exercises.